Hey YouTube, welcome back. In today's video, we're going to be breaking down the ASWB examination guidebook, so stay tuned. To my knowledge, they actually used to sell this as a resource, but started to offer it for free as of late as a PDF. And don't worry guys, I put a link down in the description below so you have access to this. And this is 111 pages long, but in this video, I really want to focus on page 30 to 40. And yeah, let's dive into it. So when we scroll down to page 30, going all the way down, here we are, page 30. Understanding examination questions. To help you understand how the ASWB examination works, we offer here a primer and exam question structure. When you know more about the questions themselves, you'll be better prepared to take your exam. And here's the new that's coming in 2023. In January 2023, test takers will begin seeing a mix of 3 and 4 option questions. Before that time, all exams include only 4 option questions. So this is big, right? Because since there's 4 options of A, B, C, and D, even if we were to guess, we have a 25% chance of getting it right. Now, with the introduction of having a mix of 3 options of ABC coming in 2023, you have a 33.3% chance of getting it right, even if you were to guess. So if we can eliminate one of them, now we have a 50-50 shot, right? And again, we really want to be able to eliminate the 2 and kind of have the clear answer. And I know some of us may be thinking like, wait a second, Ray, if I'm taking my exam in November, December, just kind of before 2023, should I hold off? Well, it really is up to you. I think we definitely should just continue to prepare as normal as we would, and, have that confidence in ourselves. If we believe that, we're well prepared for it, go in there, do our thing, and let's take the exam. But let's say if you're one of those people that, don't plan on taking an exam until 2023, then this is something to definitely be aware of. Well, let's dive back into it and continue to break this down. So examination question basics. Every ASWB question uses a 3 or 4 option multiple choice format with these parts: STEM, the main body of the question that poses the problem to be answered, and then the options, the possible answers, so the key or the correct answer, and then the distractors, that is the incorrect answers. So the STEM, what is the capital of Ohio? So we have A, Cincinnati, B, Lexington, C, Philadelphia, and D, Columbus, and it's Columbus. While a question might have distractors, the sound plausible or may be appropriate in other situations, only one answer is correct. ASWB examinations never use options like all of the above, none of the above, or combinations like both A and B. So if you've never taken an exam before, while we may have saw other tests or exams have those options of all of the above, none of the above, both A and B, that's not here. That's not present on this exam right here. Question writing style. ASWB question writers receive specialized training in how to write good test questions. They are required to follow a writing guide to ensure that every question has the same basic characteristics. This means every ASWB social work licensure exam question is as simply worded as possible, has only one correct answer, includes nothing in the question designed to purposefully trick a test taker into making an incorrect choice, and contains only content relevant to competent social work practice rather than testing trivia or obscure jargon. And again, remember, if we see something on the exam that we're just extremely unfamiliar with, where this may have came up maybe one time or just like haven't covered it at all, especially if we're reading through one of the main study sources for this exam, it could be one of the questions that don't count. So don't get tripped up so much, because remember, out of the 170 questions, only 150 questions are being scored. The other 20 questions that make up the 170 questions on the exam, they're more so being trialed to be on possible future exams. So if you see one of those that's really tripping you up, just of course do your best and let's just kind of keep it moving. Readability. In 2019, ASWB commissioned a readability study of its examinations. The study found that the examinations read at the same level as 10th grade textbooks, except, of course, for terms of art related to the social work profession. The study gave ASWB confidence that its exams test social work knowledge, not reading ability. So they're saying they're really trying to make it as simply worded as possible. So they're not using fancy wording and we need a whole thesaurus and, dictionary and all that other stuff to really break it down. Now, we definitely need to know social work terms. We'll definitely need that information. But as far as the sentence structure, they're saying, we designed it to make it as simple as possible so that we can just follow along and then answer any of the social work terms that come up if we need to, address those. The qualifiers. Capitalized and bolded words in the stem provide important information to test takers. Pay close attention to qualifiers like best, first, next, and most. And remember, these are the type of questions that make up the majority of the exam. And we have that knowledge component as well, such as the theories, human development, the macro, the DSM stuff, where that's information knowledge that we definitely need to know. And it's applying to these questions that's going to break it all down. So here's a qualifying example, a qualifier. A social worker meets with a client in a domestic violence shelter. The client tells the social worker that a decision has been made to return home to an abusive partner. What should the social worker do first? A, help the client develop a safety plan. B, refer the client for counseling services. Or C, encourage the client to remain in the shelter. And they gave the answer right here where the answer is A. And notice how it says, what should you do first? And they actually break it down right here. While the actions described in B, which is refer the client for counseling services, could be appropriate for the social worker to take later, ensuring the client's safety is the first action to be done, which is A, help the client develop a safety plan. Encouraging the client to remain in the shelter, C, does not honor the client's right to self-determination. And remember, I actually made in one of the practice questions, I can't remember exactly what number it is, but that was speaking to this scenario right here of what we should do regarding these type of situations. And we always want to honor the client's right to self-determination. And this is another, read the NASW Code of Ethics, really important. In two kinds of questions, stems have either a direct question or incomplete statement, or they contain a vignette, which is a short scenario or situation that leads to the question itself. The incomplete statement or direct question. Direct questions or incomplete statements usually require the test taker to remember specific information. So that's speaking to that knowledge aspect where, let's say they're asking us stuff about the DSM or about theories, human development. If we don't know, we just don't know, we actually need to know that information. Alcohol is a hallucinogen, B, stimulant, C, depressant, which is C, D, hypnotic. They literally give it right here. C, depressant. What drug is classified as a depressant? A, cocaine, B, caffeine, C, LSD, or D, alcohol? And the answer is D. So they're showing the different forms where they can ask you the question, where the answer is, again, the same. If you ever attended one of my study groups, that's something I would speak to where with other tested exams, and I'm talking about not just in social work, but just in general, we may be used to seeing something structured a certain way, but it's not about, we're used to seeing it ask 2 + 2 = 4. How about if they ask what's 1 + 1 + 1 + 1? What's 3 + 1? The answer is always 4, but the way it's asked can be in many different ways. Again, it's not just 2 plus 2, it's 3 plus 1, it's 1 plus 1 plus 1 plus 1. So we want to really be able to have that understanding of the question and the answer itself. And the vignette, a STEM with a vignette introduces a scenario and then asks the test taker to choose the correct answer as it is applied to the scenario. Often, the vignette ends by asking the test taker to identify an action to take. Even though a vignette may describe a specific practice setting, an agency, a school, or a hospital, for example, the correct answer is the same no matter where practice occurs. This is very, 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 very important. The environment doesn't matter as much as we think it matters, right? If you ever attended one of my RayTube study sessions that I typically have on Saturday, the things that we really want to pay attention to is things regarding time frame, right? Like how long symptoms have been going on, the age of the client or clients that we're working with. Those factors are going to influence the outcome, the answer choice, right? Versus like, let's say we're working with a minor, adult, etc., right? But the actual location is not going to necessarily influence the answer as we may think. And again, this is coming from the official ASWB. So the setting, we're not really focused on that. We're more so focused on the age of the client or the clients we're working with and the time frame of how long we've been meeting with the client or how long their symptoms have been present, those type of things. So again, even though a vignette may describe a specific practice setting, an agency, a school, or a hospital, for example, the correct answer is the same no matter where practice occurs. Every question is designed to test knowledge, skills, and abilities that apply to all social work practice. And I know that can be a lot at times because we're so used to working in certain settings like, school. And like, for example, if you're working in a school setting and we typically deal with like calling parents and guardians and things of that nature, we're not necessarily doing that at a outpatient facility if we're working with adults type of thing. So I understand how that could be like, oh, I'm not really used to that. But this is kind of meant to cover like all the settings. So they have a vignette example. A social worker meets with a family experiencing stress. Because one member recently became unemployed, what should the social worker do first? And they're giving us the three options of begin family counseling, B, assess the family's needs, or C, refer for financial services. And the correct answer would be B. I keep forgetting this, right? Assess the family's needs. Why? So let's look at this question again. A social worker meets with a family experiencing stress. Because one member recently became unemployed, what should the social worker do first? So just with that information that we have, right? We're not supposed to assume and all this other stuff. Just with this information right here. Professional, us, the social worker, we're meeting with a family. Why? They're feeling some stress. How come? Finances. Because this situation of a family member becoming unemployed, I imagine they are the breadwinner or definitely just contributing to the finances. They're unemployed now, unfortunately. What should we first do? Given these three options that they gave us, begin family counseling, assess the family's needs, or refer for financial services. Now, the reason why we assess the family's needs is because, yes, there could be other factors going on, but we don't immediately want to go to refer, right? Because we're meeting with them. We don't want to just immediately refer them out and say like, okay, thank you for meeting me. Okay, you're gone, right? If it was like a significant like medical issue out of our scope of practice, that is completely different. Like if someone came in, let's say they're having like eating disorders and we don't work with, we don't have that skill set, that knowledge working with treating eating disorders, then absolutely we refer out. And if it said that within a question itself, then absolutely, right? But this right here, we want to see assess the family's needs before we're referring them out somewhere, and also begin family counseling. Well, technically we're going to begin family counseling, but we want to assess like, okay, what's going on? So they put B as the answer. Though it's possible that the interventions in A and C, which is begin family counseling and refer for financial services, would be appropriate, they can't begin until the social worker first determines what the family needs are. Even in my private practice, right, I offer a free 20-minute consultation. When someone contacts me and, we do the introductions, and first contact is when the Therapeutic Alliance forms, just like a side note, it's first contact. And, we're discussing whatever the situation may be. And then from there, we'll schedule a consultation. So now we're moving into the consultation. So before we can really get the ball rolling with beginning therapy services, I need to firstly assess like, what is your main need? Yes, the stressor is happening, but what do you need type of thing? And then cognitive levels. Just as it's important to understand the basic anatomy of an ASWB exam question, it is also helpful to understand what kinds of thinking you'll be required to do to answer a question. Many questions require more than remembering a piece of information or fact you learn in your social work education. I've been there when studying the exam, especially for the LSW, where I'm reading through and I'm trying to memorize everything, and I do not have a photographic memory. So I was trying to memorize all the intricate details of every theory, and we need to have a general understanding of this information. But like, for example, the criteria, every single thing for the DSM-5, and we need to know the main component so that we can identify what we need on the exam when answering these questions. The ASWB examinations are designed to test your social work knowledge across a range of kinds of thinking or cognitive levels. In performing your social work task, you'll rely on several thinking processes. Those same cognitive skills are defined and applied to ASWB test questions. They are divided into three basic cognitive levels: the recall, application, and reasoning. Recall is considered the most basic kind of thinking process. Reasoning is considered the most advanced, and application is somewhat or somewhere between the two. A social work task may require recall. This is simply remembering something, for example, information you learned in school or from a seminar or text. Application, this means using what you've learned in a particular situation. Or reasoning, this involves sorting through what you've learned along with considering the situation and other relevant information. You will encounter all three cognitive levels in the examination, but the mix will depend on the category of the examination you are taking. The ASWB examination committee uses the cognitive levels in approving and assigning questions for the examinations. Each ASWB exam contains recall, application, and reasoning questions. The associate and bachelor's exams have a larger portion of recall questions and a smaller portion of application and reasoning questions compared to the master's, advanced generalist, and clinical exams. So again, if you ever attended one of my study groups, the actual information is the same across the board. So for example, when I was in a master's program, I don't remember them saying, hey, this is your DSM. Oh, and then when you graduate and preparing for the clinical level and stuff, oh, here's your DSM. It's the same DSM for our practice. The same DSM. Same thing with the NASW Code of Ethics. It's not like one group, one level has their own special NASW Code of Ethics, and then another group has their own special NASW Code of Ethics. Same thing with theories. Oh, here's your forward theory, but then here's your forward theory. All the information is the same, is what I'm saying. It's more so there's more type of questions on a certain exam versus the other. And how they ask the questions. Like they said here, there may be more recall on this exam and more reasoning on this exam type of thing. So again, the information across the board is the same. Level 1 recall. Recall is a description or definition without application to a situation. It requires remembering learned material and may involve the recall of a wide range of information, from specific facts to complete theories. It also requires grasping the meaning of material, shown by translating it from one form to another, explaining or summarizing it, or predicting future trends, consequences, or effects. So when we talk about human development and theories, remember how if you've seen any of my theory videos with Erikson and Freud, one thing they talk about is if certain needs aren't met at certain stages in our life and they're just not met, that can translate into adulthood where certain things can become problematic or developing unhealthy forms of coping or whatever it may be. So that's what they're saying, being able to apply and kind of see the trend, if you will, if just certain things aren't met. Answering recall questions correctly depends only on remembering information. The questions may ask about abstract ideas without the context of a particular situation. Sometimes, as in example 1, recall questions include a particular setting, but they will require only straightforward recall of knowledge. So, example 1 for the recall, a social worker at a substance use treatment center meets with an adolescent client who expresses remorse about engaging in sexual activity while drunk. The social worker tells the client that sexual promiscuity while intoxicated may indicate alcohol use disorder. What best describes the social worker's approach? A, education, B, confrontation, C, summarization, or D, clarification. So the social worker informing the client of this goes right to the education piece of it. Recall example number 2, the termination process is most often associated with A, evaluating goals and accomplishments, B, implementing a plan of action, C, setting limits, or D, developing a contract. And the answer is A, evaluating goals and accomplishments. So it's, again, determination process is discharge. It's towards the end of treatment of services, right? So we're not necessarily developing a contract or setting limits and implementing a plan of action. Again, that's, in terms of therapy, the treatment plan is created far before the discharge or termination process. But during the termination or discharge, that's when we're just kind of doing reflecting, if you will, of like the progress that they made, and which is including the accomplishments of their goals and evaluating like what we actually worked on and everything. Recall example number 3, what part of the helping process is most important in developing a therapeutic alliance? Is it A, contracting for service, B, intervention planning, or C, establishing rapport? And it would be C, establishing rapport, because again, talking. We need to talk. We need to establish that rapport before anything else, like that initial contact. Level 2 application. Application is the use of information in a specific situation. Answering application questions involves using learned material in concrete situations and may also require the application of rules, methods, concepts, principles, laws, and theories. So again, when I say do at least 2 practice questions a day, it helps keep the exam anxiety at bay. It's not about just only bombarding ourselves with practice questions. We still want to do them. Do not get me wrong. We still want to do them. Again, 2 a day. Let's say on the day you have off, like let's say if you have the weekend off on a Saturday, you want to step it up, do more? Absolutely, right? But we need to know the information piece of, again, the theories with the human development, like all like the DSM stuff, like that stuff. And while we're doing our practice questions, and I say 2 a day so it's not overwhelming. We're not trying to do, 170 questions a day type of thing. A social worker facilitates a treatment group for juveniles who are court mandated to attend. During the first session, a 13-year-old brags to the others about vandalism committed in the neighborhood. What should the social worker do first? A, discuss the client's behavior with the parents. B, confront the client about the behavior. C, encourage the client to talk about possible motivation for the behavior. Or D, report the client to the court. And they give us the answer here. C, we want to encourage the client to talk about positive motivation for the behavior, right? We don't just want to report them to the court and confront them about their behavior. Like if it continues and escalates and everything like that, but, especially while in this setting, what is the motivation for this? 2, application example number 2. A student's family is referred to a school social worker because the student has been disruptive in the classroom. At the intake interview, the parents tell the social worker they are preoccupied with finding employment and may lose their housing. What should the social worker do next? A, tell the parents the student must behave better in school. It's like, okay. B, arrange an assessment interview with the student. C, assess needs related to the issues affecting the family. D, help the student talk to the parents about the reasoning for the behavior. And we're going with C, assess needs related to the issues affecting the family. So when working with the family unit, a student's family is referred to a school social worker. A student's family is referred to the school social worker. So we want to be able to kind of, help all of them and see, or essentially see like, hey, what's going on here? So when we talk about assess the needs related to the issues affecting the family, remember in the earlier one that we covered, we want to see like, hey, like what's going on? Where are we meeting at? What specifically are we trying to address and how we're going to approach it? Like we need it to kind of be all laid out for us. Just like in the other one, it's like, oh, unemployment. We don't refer right away because there could be other factors contributing to that we will want to address and that they want to address as well. So that's why. Application example 3. Residents of a neighborhood are concerned about increasing crime rates. The residents ask a social worker for help. To help the residents work together to improve their safety, what process should the social worker use? A, program development. B, community organizing. C, social reform. So just going off the wording alone, it would be B, community organizing, because they're talking about the community. Social reform, that's on a bigger scale, and program development, while programs do come into place, like we're talking about the community here, because it says residents of a neighborhood are concerned about increasing crime rates. And they break it down a bit more. In these examples, the test taker reads a short vignette about a particular situation. To answer the questions correctly, the test taker must do 2 things: recall information and then apply the knowledge to the scenario. When you answered the questions, you probably performed the 2 operations seamlessly. The first example requires recalling information about human development at various stages and about the dynamics of group processes. The second example tests understanding the importance of the environment. The third example requires knowledge of community development models and understanding the stated needs of the neighborhood residents. To answer each, the test taker must apply those pieces of knowledge to the scenario. Level 3, reasoning. Reasoning requires using information in a certain context with more information and options available. Individual judgment may also be used. Questions may involve breaking material into its parts to understand the organizational structure. Reasoning questions may also include the identification of the parts, analysis of the relationship between the parts, or recognition of the organizational principles involved. Reasoning also involves putting parts together to form a new whole. And I know I'm like, wait, Ray, that just sounds like a lot of blah, blah, blah. Pretty much, we want to identify what parts connect with other parts, what makes sense, given the context of the question. So let's see what they got here. A social worker at an inpatient psychiatric facility meets with a 40-year-old patient and the patient's family to discuss discharge planning. The patient has a diagnosis of schizophrenia and a history of assaultive behavior and substance use disorder. The patient's parents want the patient to move into their home. What factor should the social worker evaluate first? What factor? Safety above all. Safety above all. Confidentiality goes out the window. Self-determination goes out the window when it comes to safety. Imminent, foreseeable risk to themselves or others. Imminent, foreseeable risk to themselves or others. Not things that are like vague or anything like that. And this says history of medication compliance. And no, that's not first. Potential danger to the family. Likelihood of exposure to illegal substances, and opportunities for outpatient treatment. As far as first, key B, potential danger to the family, because in this context right here, they're highlighting, hey, this person was in an inpatient facility, has schizophrenia with a history of assaultive behavior and substance use disorder, meaning like, if you're under the influence, your decision making is impaired, and you have schizophrenia with a history of assaultive behavior, and you're about to go live with the patient's the patient's about to go live with his parents. This is a factor that we 100% want to consider. As they said, what factors should the social worker evaluate first? Reasoning example number 2. A social worker meets with a patient who has been in psychiatric hospital for 3 weeks. The patient's diagnoses include depression and substance use disorder. The patient is prescribed psychotropic medications and an anticonvulsant for a seizure disorder. For several days, the patient has experienced drowsiness, stumbling, and slurring of speech. What should the social worker do first? Consult with a behavior therapist for a behavior management plan? Not right away. Review the patient's discharge plan? No. Evaluate the patient for hidden substance use? No. Consult with a psychiatrist for a medication evaluation? Yeah, I would go. And it's D. So right off the bat with this one right here, also in my mind, I'm seeing like what answer kind of stands out to me and which ones do I just like, no, that just doesn't sound right. Again, they're asking, what should we do first? Consult with a behavior therapist for a behavior management plan? Not right now, because it's saying a social worker meets with a patient who has been in a psychiatric hospital for 3 weeks. Okay. The patient's diagnoses include depression and substance use disorder. Okay. The patient is prescribed psychotropic medication with an anticonvulsant for seizure disorder. Okay. Right. So all I'm hearing is, okay, they have this disorder. They're here. We've been meeting with them. Okay. So what are we being asked? For several days, the patient has experienced drowsiness, stumbling, and slurring of the speech. So they're having some effects, right? What should the social worker do first? So if they're having these effects, given the answer choices, am I going to evaluate the patient for hidden substance use? Hidden? Not really. The first thing I'm going to do, hey, do you got something hidden under there? Are you lying to me? That's not the first thing we're going to lead with, that type of thing. Is it possible and all that? Maybe, but we're not going to lead with that. The first thing we should do, review the patient's discharge plan. The first thing we should do, discharge, last, termination. Consult with the behavior therapist for a behavior management plan. That's like more middle-ish, early middle type of thing. Consult with the psychiatrist for a medication evaluation. Yeah, let's see what's going on, because this patient is clearly having effects from that. So that's the thought process of D. Reasoning example 3. A school social worker answers a call from a parent asking for help with a teenager's behavior. The parent tells the social worker A social worker, the teenager is frequently defiant and aggressive toward a younger sibling and family pets. What is the social worker's most appropriate response to the parent's request? A, suggest new discipline strategies for the parent to use. B, recommend the teenager receive a mental health assessment. C, explain that the teenager's behaviors are normal for this age. Or D, consult with the psychiatrist for a medication evaluation. So let's work backwards a bit. D, consult with the psychiatrist for a medication evaluation. That's meds like right away. That's like, hold on. C, explain the teenager's behaviors are normal for this age. Where's the part that said something about, pets, define aggressive towards younger siblings and family pets? No. B, recommend the teenager receive a mental health assessment. Yes. Why? Let's see what's going on. What's going to find out what's going on? An assessment. And then A, suggest new discipline strategies for the parent. Assessment first. Then, if applicable, we can suggest strategies for the parents to use and how to proceed and things of that nature, like that education piece. But assessment, we need to really see what's going on, because it could bring light to other factors that we didn't even consider, or things that's just more information. But the assessment is going to clear all of that up for us. So that's why we will want to go with B. These questions require the test taker to pull relevant information and knowledge from a variety of sources, including professional experience. Often, these questions will include qualifiers like best, first, most, appropriate, and most likely to focus your reasoning process. More than one option in a reasoning question may reflect good social work practice, but the context and qualifier will lead to only one correct answer. In the second reasoning example, it may be acceptable to evaluate the patient for surreptitious substance use. Surreptitious meaning like to hide something. So like when they're like saying like, oh, are you hiding substances and stuff like that? But that should be done only after a medication evaluation has been conducted. The question asks for the first action. And remember how they could ask it like not just 2 + 2 = 4. Like if the answer is always 4, it's not like they're asking 2 + 2. They might be asking what's 1 + 1 + 1 + 1. Because if the question said after conducting a medication evaluation and everything checked out and stuff like that, then yeah, that could be a route to go to see if like, okay, let's see if they have something like that going on. But it said the first action. Reasoning questions use recall and application operations and are therefore more complex. Because answering a reasoning question correctly depends on a combination of knowledge sources, reasoning questions are used more frequently in the Master's, Advanced Generalist, and clinical examinations. Associate and bachelor's examinations contain reasoning questions, but the proportion is much smaller. So again, depending on which exam you're taking, it's all the same information. But essentially what this is saying is in the earlier exams, they're going to give it to you more direct. Later, they're going to give it to you a bit more in a more complex way, just a bit more reasoning based and everything. Answering the questions. The social work licensing examinations are based on the actual task of social workers. The settings may vary, but the experiences are shared. The questions aren't designed to trick you or to present basic social work ideas in confusing ways. The exams are designed to measure your social work skills and knowledge. Understanding the multiple choice format can help test takers choose the correct answer to each question. Use the information in the question. For many of the questions on the ASWB examinations, you will likely know the correct answer with near certainty. Your social work education and your professional experience have prepared you. Other questions might seem more challenging. In those cases, a key skill is keeping focus on the question itself. So they're saying use the question itself to help guide you to the answer, and also just having that knowledge piece and how to apply it to the actual question in the context that they're giving it to you in. Each question on the exam is written as a self-contained unit. You may be asked to rely on your reasoning and application skills, but you will never be expected to add information to the STEM. Read each question carefully and respond to the question as it appears, not as it may be affected by factors not included in the STEM. So we have to take it at face value, right? We don't want to like just add in other factors and things of that nature of like, well, this could happen. It's like, wait a second. Just like with the when we're answering it, we can even if we can think of a better option, cool. We have to use what's given to us, A, B, C, or D, or if it's at in 2023, A, B, and C. Make sure to answer only the question you are reading and not the questions you've created through assumptions or second guessing. Steps for choosing the correct answer. Going through a series of steps as you answer each question may help you arrive at the correct answer. Without looking at the options, anticipate the correct answer. After you've read the question stem, anticipate the correct response. You may not use the exact terminology or phrasing that the exam does, but thinking ahead about what the response should be will help you select the correct answer or narrow down the choices. So remember, for those that saw my video, the serial method, right? I talk about the red flags. If we're reading a question and we encounter a red flag, like a safety concern or things of that nature, right? In my mind, I'm thinking, okay, as I continue to read, unless that red flag was addressed appropriately within the question itself, that's where my mind is headed. I don't know how it's going to be worded in one of the answer choices. So, for example, and also one of my practice questions I have it addresses one of these. If a client says a vague statement of "I'm going to let my boss have it tomorrow," you'll want to clarify, what do you mean by that statement? You're going to let your boss have it tomorrow. And let's say they just skip over it. If they give you the answer option, you want to ask them again, excuse me, what did you mean by that? Because it could be a safety concern. Like, I have to say, I'm about to go there and like do something not cool to them, then we want to address that, right? But if it says something like, oh, I'm just not going to volunteer to do extra work like I normally do, it's like, okay, so that red flag has been addressed appropriately, and then we can proceed. So that's an example of what they're saying, like try to anticipate the answer when you're reading through the questions. Go back and reread the stem, take it apart. Maybe you've anticipated a response, but you don't see an option that corresponds. Or maybe you couldn't make a good guess. Go back to the stem and read it carefully. In your mind, pull out the most important details of the question, paying attention to specific terminology. Examine exactly what you are being asked to do without adding any information. Here we demonstrate how to take apart this stem. So, the example, a social worker interviews a client with a history of resistance to treatment and hostility towards agency staff. To involve the client and establish a therapeutic alliance, what should the social worker do first? Okay, so before I even continue to read, right? A social worker interviews a client with a history of resistance to treatment and hostility toward agency staff. Okay. What is the question asking? To involve the client in establishing a therapeutic alliance, meaning there are some issues in the past. This go around, we want to have that therapeutic alliance, right? What should the social worker do first? What do we know about establishing a therapeutic alliance? We need a good rapport. That's where my mind is going when I read that. So, A, conduct a mood assessment with the client. B, engage the client in a discussion of the presenting problem. Review the history of services with the client. Or D, refer the client to an anger management group. So D, refer. What should we do first? Refer. So that's already gone. Review the history of services with the client. That may be a thing, but first, engage the client in discussion of the presenting problem, because when we're engaging, we're talking, and it's a collaborative effort, and that's part of the therapeutic, establishing the therapeutic alliance, the rapport, and then conduct a mood assessment with the client. That's not the first thing. To reread and take apart the stem, follow these steps. Pull out the most important points from the first sentence. Situation is a client interview in an agency. And then its client has a history of resistance and hostility towards the agency. For 2, identify what the question is asking for. What is the first thing for the social worker to do to involve the client and establish a therapeutic alliance? Select the first action the social worker should take to involve the client and ensure forming a therapeutic alliance. So although A, C, and D may be acceptable social work practices and even appropriate for the client at some point, they are not the first thing that a social worker would do to involve the client and ensure forming a therapeutic alliance. Only key B fits those criteria because engagement is an important part of involving the client and forming a therapeutic alliance. So they're saying the answer is B. And yep, engage a client in a discussion of the presenting problem. The words in bold, caps, most, first, next, and best, etc. are extremely important in determining the correct answer, but always be sure to pay close attention to what comes after the word most what, first what. These words are just as important as the capitalized words because they're saying like, okay, they're talking about most, literally most what, as they said here, most what, first what, like what step are we talking about? What exactly are we talking about the first of, right? Strike through the answers that are obviously wrong, like the ones where you say like, oh, refer, like the first thing. No, again, unless it was a situation where the question says something like client comes in, they said they're there for like an eating disorder and we don't specialize that at all and everything like that, then yeah, like we would proceed with referring them out and stuff like that. But yeah, so what it says, the first thing, that's why typically we would roll out refer. Strike through the answers that are obviously wrong. Even a question that you find difficult will have one or two distractors that you know are incorrect. The testing software allows you to strike through those distractors so you can focus on the ones that aren't so easy to eliminate. Then repeat the earlier steps to see if that helps. So when you're taking an exam, they're giving you the option to actually put a strike through the answer choices to help so you can literally see, not just visualize, but like literally see it in a clearer way. And 4, select an answer for every question. When you feel unsure about an answer, it's better to select an option than to not select one. When your examination is scored, a question without an answer will always be counted as incorrect. So always put an answer. If for right now, right, 4 options, A, B, C, and D. Even if you were to just guess, you have a 25% chance of getting it right. If you can do your best to eliminate one, now you go up to a 33.3% chance of getting it right, even if you just to wing it. Now, if we can eliminate 2, then, you know, of course, we're going to feel good about picking that answer choice. But we always want to select an option. You know, nothing to lose, something to gain. If we get it wrong, we took a shot at it. If we don't pick anything at all, that's a guarantee that we're going to get it wrong. When your examination is scored, a question without an answer will always be counted as incorrect. Some standard exams deduct additional points when an incorrect answer is selected, but on the ASWB exam, additional points are not deducted for incorrect answers. That means that if you randomly guess, you'll have a chance of receiving credit. If you can eliminate 1 or 2 options before you select an answer, your chances of selecting the correct answer increases. Tricks won't work. Some manuals or test preparation offers tips in how to pass multiple choice tests. Some of the strategies are very useful, but some advice might hurt your score on the ASWB examinations. Passing this multiple choice examination relies on demonstrating knowledge and competence, not memorizing tricks or patterns. So when it comes to specific like definitions and orders, things that's not going to change, yeah, 100%. Like with the medications, if you checked out the medication video where it's like, oh, these set of anxiety medications start and end with this. These set of depression medications start and end with this. That's not going to change, right? But as far as using certain tricks when it comes to answering multiple choice, remember, if the answer is always 4, but it can be asked in what's 2 plus 2, what's 3 plus 1, was 1 plus 1 plus 1 plus 1, was 0 plus 4. It's so many different ways that it can be hard and challenging to apply that method that we may be using to all of the multiple choice, because it's asked in so many different ways and we may not even know how to apply it correctly or if it will be applicable to use for that specific question. That's why they're putting that in here. Don't choose or eliminate an answer based on length. Just because one option on an ASWB examination is longer or shorter than the other doesn't mean it's right or wrong. There are no patterns to the answers. Correct answers are not more likely to be assigned to a particular letter. There are no patterns to the questions. Questions do not, for example, start from the easiest and proceed to the most difficult. And while each examination will always follow the content outlines included in this guidebook, the order of the outline does not dictate the order of the questions on the test. The questions are delivered in random order on every exam. Okay, guys, that's it for today's video. Thank you for watching. I appreciate it. And definitely check out this ASWB examination guidebook. I mean, this is a really good source, where it not only gives you practice questions, it walks you through how to really break them down, and they even give you an outline that you can, structure to your own liking, your own schedule, and so that you stay on task. So I'm gonna have this link down in the description below, so you can just click it and then I'll bring you right to this right here, so you can print it out for those that like to print it out, or just save it as a document on your computer, desktop, laptop, wherever it may be. And yeah, like definitely use this as a resource. And as always, share with a social work friend, because we don't want to be licensed by ourselves. And breathe. You got this. You're going to keep studying. You're going to do your at least 2 practice questions a day, because it helps keep the exam anxiety at bay. And we're going to keep at it. You got this. All right, guys. See you next video. Bye.